Hi, Kevin Henry with Dental Assisting Digest. I'm here today at the OSAP meeting in Tampa, Florida. I'm talking to my friend Cindy Bradley. And Cindy's a dental assisting instructor in the Orlando area. And one of the things that, well, some of the things that we're going to talk about today are some areas that maybe dental assistants don't think about that could be really counterproductive to their advancing in their profession.
Their image, their professional image.
And there are things that unfortunately you're seeing quite a bit.
Yes.
So tell me some of those things that we've talked about a little bit already.
Well, probably the biggest concern is the tattoos and the piercings.
Okay.
I think everyone would agree that dental assisting is a very conservative profession.
Yeah.
So we don't want to alter anyone's personalities, but we need to make sure that you present a good image to get into the profession.
Okay.
So if you have visible tattoos or piercings, as we like to say it, unless you have something other than the original hole in your ear, then they could be presented as unprofessional.
Okay.
So a lot of the students, we'd have to inform them that they need to have their tattoos covered.
So like they may go all the way down to...
Correct.
Okay.
Correct. I'm not saying that doctors wouldn't hire them, but the doctors that would are far and few between. So a lot of our doctors would want you to have the tattoos not to be visible.
Okay.
Piercings, tongue piercing, obviously that's not something we want in dentistry because of all the ramifications that a tongue piercing can do to the oral hygiene. So those are two big concerns. Another big concern is Facebook, email, and voicemail.
And tell me what's going on that you're seeing with that.
Well, obviously they're great, and tweeters. We forgot about the tweeters.
Oh, that's right.
Yes, can't forget the tweeters. Well, it's great social media, but the biggest concern is, are your Facebook postings professional?
Okay.
A lot of our doctors are checking Facebook before they hire their staff.
Right.
And so you want to make sure that you present either a real strong privacy block, or you only on your main Facebook homepage, all professional.
Okay.
Be careful of the pictures, be careful of your words that you use, your language. Because doctors will check that.
Sure.
Also, your email addresses. Be very, very careful. If you're going into the profession, have a personal one. That's fine. Again, we don't want to alter anyone's personalities, but have a personal email that you would use for friends and family, and then a professional email. And you can go to Hotmail, you can go to Yahoo, and get just your name, cindy.bradley@yahoo.com.
Sure.
Very professional, that you would want to put on your resume. The other thing is your voicemails. If you're trying to get a job and your cell phone is your sole source of communication, then you want to make sure that you don't have a voicemail that has a lot of music, because doctors don't have time, or the staff who's calling you, to listen to it.
Sure.
Very short and sweet. Hi, this is Cindy. I can't come to the phone right now. Leave your message and I'll call you back. And don't just leave a phone number. And don't leave a lot of music. Don't. Be careful what you say, because you never know who's doing the calling. Those are things that we see right now that are, I don't want to call them roadblocks, but they can hinder, as you said earlier, your professional career.
And those are things that you've actually seen that
Absolutely.
Where dental assistants haven't gotten a job because of an email address, or they've been checked out on Facebook.
I've had students that have been fired for Facebook, what's the word we want to use? Facebook conversation, I guess. I'm not sure. I'm not that good on the social media stuff. But topic, pictures, words, and a doctor overheard a staff member talking about her Facebook to a patient. He went in and looked at it, was mortified at the language and the appearance of pictures being taken in certain locations, and he asked her to give 24 hours to clean it up, and she didn't, so he fired her.
Wow.
You're representing the doctor. Some of these doctors have multi-million-dollar practices, and when you're there, you're representing them. So, again, keep your private life away from your personal life, and that will be the biggest factor.
Yeah, and that's one thing I want to stress is we're not saying you can't get a job if you have tattoos or piercings. It's just that you're going to have to understand that there may be a few more hurdles that you're going to have to jump, and a few more precautions you're going to have to take. Maybe.
Correct, and you have to realize too that they're the baby boomers, and the baby boomers, which is those of myself, that age group, we're the ones doing the hiring right now.
Yeah.
Maybe in 10 years, tattoos and piercings won't be an issue. Right now, it could be. So just think about it. Keep them where you can't see them, and think about that before you start your career. You're also working with patients, and unfortunately, we are in a society that is very judgmental.
Yeah.
And sometimes your first impression is not always your best, and so be careful of that. I had a student who had lots of tattoos, and was told that he was judged by a lot of people. Turned out to be one of the best students we've had.